There's a new HIV prevention pill that is 100% effective in a
Federal
new
health
study.
officials have given the green light to an antiretroviral daily drug that could help prevent
The CDC
HIV.
wants more people who are at risk of getting HIV to take a daily pill called PrEP. Now, the pill is more than 90% effective in preventing the virus, and the FDA
approved the HIV drug that may help healthy people by preventing them from contracting the virus that causes AIDS.
Well, a major breakthrough tonight to help stop the spread of HIV is now
this
available.
Pill, according to this recent study, is 100% effective.
When healthy people with a high risk on getting infected with AIDS use it on a daily basis, it has the same effects as a condom.
This will take away some of the stigma and some of the shame that we who use PrEP have to deal with when we decide to be responsible about preventing HIV in this way.
The Hamilton Polari Project and Ori Video Productions is proud to present this informative video about the PrEP revolution. It is a promising breakthrough discovery for a long overdue awaited change. The game changer PrEP, which stands for Pre-Exposure Prophylaxis. Just imagine, if there was a pill that could help prevent HIV and stop it from spreading once and for all. Well folks, the time has finally come. There is such a pill and it is called Truvada. In this video we will try to explain simply and clearly what this means to you in protecting your health and the health of others. The Polari Project will also complement this video with a full complete up-to-date detailed section on our website. Now if you happen to check either the Hamilton AIDS Network or the Hamilton Public Health websites for information PrEP, you might have been surprised to find no mention at all. This is both very sad and disappointing that they do not feel as strongly as many local AIDS service organizations, researchers and frankly the rest of the world the importance of Truvada. Rest assured that the Polari Project will make sure that Hamilton is not left behind in the dark. Sign up for the Polari newsletter to stay in touch and current about PrEP and other important issues. We will not let you down, Hamilton. And now to find more about this exciting news, let's join Laura outside. Laura, thank you for joining us today.
My pleasure, Paul. Thank you for inviting me.
Can you start perhaps by giving us quickly some local stats so that we can better understand the current state in Hamilton?
Certainly, Paul. Not a problem.
Thanks.
Let's begin by quickly going over what are risk factors. A risk factor is something that increases your chance of getting a condition, disease or an infection. The most common risk factors for getting an STI: having sex without a condom, already having an STI. For example, if you have herpes you have a higher chance of also getting HIV. And having sex with someone you just met and you do not know their sexual history. According with Hamilton Public Health, not using condoms is the #1 risk factor. Here are the most common top 4 STI in Hamilton. Fourth is HIV/AIDS. HIV/AIDS has been decreasing since 2003. Out of 20 cases, 16 were HIV and 4 AIDS. 90% of cases were in males. The third most common is syphilis. Infectious syphilis is increasing. Out of 60 new cases of syphilis, 42 were infectious and 18 non-infectious cases. Most cases of syphilis are in men who have sex with men. Gonorrhea is the second most common STI in Hamilton with 166 cases. Slightly more cases in males. Chlamydia is the most common STI in Hamilton. Out of 1,411 cases, about 2 in 3 cases are in females. And Paul, one last statistic I found interesting was that 84% of people in Hamilton aged 15 to 49 have had sex. 70% of these people were teenagers the first time they had sex. Well, that is all I have for now. Thank you. I will now hand it back to you, Paul.
Thank you, Laura, that was great. May I ask you just one more thing?
Sure.
How can the folks at home find out more information?
Well, you can find more statistical information by visiting the City of Hamilton website at www.hamilton.ca/STI. Or you can find a mountain of information by visiting the Polari Project website at www.polariproject.com.
Thank you again, Laura. We will talk to you again soon.
You are welcome, Paul.
Now, after all those numbers, we would like to take you where the majority of HIV-positive patients in the Hamilton area go for their care and treatment. The Special Immunology Services Clinic, or also called the SIS Clinic, is located at the McMaster University Medical Center, 1200 Main Street West in Hamilton. Clinic serves HIV-positive adults, infants, children, and adolescents who are HIV-positive or have HIV-positive parents, and clients co-infected with HIV and hepatitis C. Statistics show that men continue to make up the largest number of people living with HIV and AIDS. In Ontario, approximately two-thirds, 66.5% of people diagnosed with HIV in 2008 were men. Brand new, fun and totally free, online game called the PrEP game. It is available right now on our website for you to play for free. The SIS Clinic registered 656 new patients between 2010 and 2011. 80% of the patients are from within the catchment area. Most of the patients who joined the SIS Clinic were adults over the age of 18. A small number of patients are children under the age of 18, who are either HIV positive, or have parents who are HIV positive. Patients who enrolled at the SIS Clinic were slightly older than provincial and national averages. The majority of men and women were between 41 and 50 years of age. So do you think you are ready for PrEP? Or simply want to find out more about it? If you are a man who engages in high-risk sexual behavior with multiple partners that puts you at risk for HIV, then protect yourself. Here is what you need to know and the steps to take if you are thinking about going on PrEP. Let's first take a look at some of the research and trials done with Truvada for HIV prevention conducted in the last couple of years. We have seen a range of results from different completed PrEP clinical trials with gay and bi men, trans women, heterosexual women and men, and people who inject drugs. Here is how they stack up. From the New England Journal of Medicine, in study conducted with gay and bi men and trans women in a PrEP clinical trials by IPRX had nearly 2,500 participants, half on Truvada and the other half with placebo pills. The analysis showed that the group assigned to receive Truvada had a 92% reduction in HIV risk compared with those who received placebo. The Partners PrEP study, funded by the Bill and Melinda Gates Foundation, looked at Truvada compared with a placebo in more than 4,500 heterosexual men and women in Kenya and Uganda, who are in couples with one partner HIV positive. Researchers found a reduction in new infections of up to 90% in those with detectable drug in their blood. And finally, the Bangkok study compared Truvada with a placebo pill in more than 2,400 participants who reported injecting drugs. Truvada was associated with almost 74% overall reduction in risk of HIV infection with IDU participants. Several other trial findings can be found doing a search on the internet. The only country who has approved Truvada for protection has been the United States, Brazil, South Africa, and Thailand have applications filed for a prevention indication. Botswana, Canada, Ecuador, France, Germany, Kenya, Peru, Tanzania, Uganda and the UK are currently in trials with no filed application for prevention. However, in Canada in 2006, the British Columbia Centre for Excellence in HIV/AIDS introduced treatment as prevention in BC. Since then, BC has been the only province in Canada to see a decline in new HIV cases. So are you prepared for PrEP? Everyone is talking about PrEP, but some people get confused between PEP and PrEP. Both are new ways to prevent HIV. PEP is for emergency use and PrEP is for daily use. An HIV-negative person who has had a possible high-risk exposure to HIV within the last 72 hours should consider taking PrEP. PrEP consists of a combination of 2 to 3 anti-HIV drugs that an HIV-negative person who may have been exposed to HIV takes to reduce their risk of HIV infection. PrEP should be taken as soon as possible, within 72 hours of being exposed to HIV. These prescription drugs need to be taken every day, exactly as directed, for 4 full weeks. And then there is PrEP, which we already mentioned means pre-exposure prophylaxis, and it is the use of anti-HIV medication that keeps HIV-negative people from becoming infected.
Well, while a vaccine or cure may one day end the HIV epidemic, PrEP is a powerful new tool that has the potential to alter the course of HIV today. And these new guidelines represent an important step towards fully realizing the promise of PrEP. We should continue to build on this momentum.
PrEP in 2012 was approved by the FDA in the United States but not yet in Canada. It has been shown to be safe and effective.
Our CDC recommends PrEP for people who are at substantial risk for HIV. For instance, a person in an ongoing relationship with a partner who has HIV, or a person who injects illicit drugs and shares needles.
A single pill taken once daily, it is highly effective against HIV when taken every day. The medication interferes with HIV's ability to copy itself in your body after you've been exposed. This prevents it from establishing an infection and making you sick. Truvada for PrEP is taken once a day, at the same time each day. You can take it with or without food. In order to benefit from this medication, adherence is critical. A person taking PrEP needs to be monitored for side effects and other complications. Blood tests may be performed to ensure that the anti-HIV medications are not causing harm to the body. Even though PrEP has been around in the US for over a year, not a lot of people know about it. And even fewer people feel like they know enough about it to be able to make an informed decision about whether or not to use it. For those who do use it, the information they have might be more focused on practical issues, like where to get it, rather than on what PrEP does in the body to prevent HIV infection. It is estimated that it takes at least 7 days for PrEP to reach high levels of protection in the body. You should expect to see your doctor every 2-3 months for follow-up. If you are getting PrEP through a clinical trial or demonstration project, then you may see your doctor more often. It is important to take your pill every day, but every now and then it is perfectly human to forget. If you routinely take your pill at night, and remember when you wake up in the morning, it is fine to take your missed dose with breakfast. The opposite scenario also works. Just do your best to remember next time. Rates of side effects while on PrEP are low. Mild symptoms such as stomach cramps, headaches, vomiting and loss of appetite may appear the first few weeks. Long-term use may raise issues of kidney health and bone density. Your healthcare provider should regularly test for kidney function. These minor symptoms eventually resolving themselves over time. Alcohol and recreational drugs are not known to interact with Truvada for PrEP. It is safe to take PrEP after a night on the town. PrEP does not prevent you from contracting sexually transmitted infections, such as gonorrhea or syphilis. It is important for you to be regularly tested for these infections and to be treated promptly. You need to see a doctor for a prescription or join a PrEP research study. If your doctor simply does not know what it is and is uncomfortable prescribing it, ask them for a referral to someone who might be better able to meet your needs. If they say they do not know anyone to refer you to, ask whether it might be possible to be referred to an HIV specialist. Dr. Kevin Scott Woodward at the St. Joseph's Healthcare is seeing people interested in PrEP. He can be contacted at 905-522-1155 extension 33998.
And PrEP has the potential to alter the course of our journey to the end of the epidemic. And these new guidelines can serve as a roadmap, ensuring PrEP is used by the right people, in the right way, in the right circumstances.
Well folks, we have run out of time. We hope this video has shined a light to help you make an informed decision on PrEP. It is now time for both male sexual partners to take responsibility for each other's health. The burden should no longer be solely on the HIV-infected guy. I want to thank my co-host Laura for doing such a wonderful job with the Hamilton stats.
You are welcome, Paul.
On behalf of Ori Video Productions and the Hamilton Polari Project, thank you for watching. Goodbye for now.
Protect yourselves, love yourselves, respect yourselves, because I will keep on telling you until you do, and I won't give in, and I won't give up, because the world needs you to live.
That we have the same dreams, therefore we deserve the same chances. That would be something really worth doing.
For those who never returned and never left our hearts and never will. Peace, love, good night.